Okay, now we are on record. So again, good morning to everybody and welcome to the second webinar by the Thematic Network on Societal Impact of Pain. As you know, we are hosting these thematic networks on our health policy platform, and the thematic networks are invited to write a joint statement on a specific topic, and the topic here is societal impact of pain. We have had a discussion on the first version of the paper. We are now looking at the second version. I would like to thank very much Vittoria and also Anka for preparing this comprehensive draft. In this webinar, Vittoria and Anka will be introducing this paper, and then you will all get also the possibility to comment on it in the webinar, but you will obviously also have the opportunity to write your comments and send them to Anka or Vittoria in the next days. So now I would like to hand over to Anka and Vittoria to present the paper.
Good morning, everyone. Would like to share the screen if possible. Anka? If you could give us the presenter, right, so that we can share our screen. Do you hear us? Can you hear us?
I can. I'm Willem Scholten.
Anka, Vittoria, you have the presenters right now, exactly. So we are looking at your presentation. Yep.
Welcome, everyone. Thank you for joining. We plan to go through a short introduction to what the...
Anka, is there anything you can do to your microphone? We hear you just very softly.
I can try, but this is for hearing, not for the microphone. Is it any better? Is it any better? I will just try to speak louder. Does that work? We could try to use the microphone. Is it any better?
No, not for me.
Okay. I don't hear you, so because we don't hear it. Okay, we'll just try to speak louder if that's all we can do. So thank you very much, Ingrid, for the introduction. We are working on this platform for the second time for a second webinar concerning the thematic network of the societal impact of pain. Just a short reminder of what the societal impact of pain is and who is involved in this project. The platform is scientifically taken care of by the European Pain Federation, EPIC, the representative next to me, and Pain Alliance, which I represent here now, together with some colleagues which might be online. One of the main partners together with the Active Citizenship Network, and we are supported for the non-financial support as well as funding by the pharmaceutical company Grunenthal. What have we done so far, being on the EU health policy platform? We have organized the information, the data, the documents that we had in this and in a structure, in what we think is a comprehensive structure. You can find here the documentation.
Sorry, it's really, really low, and people in the chat are saying that they cannot hear you. It's not only in our meeting room. Sorry, when you connected the first time, I could hear you. So it has to be
So I will try. I will try to open it from my computer. Maybe it has a better microphone.
Yeah.
Okay. How do you hear me? I have a slightly louder voice. Do you hear me any better?
A little bit, yes.
But it's okay. So the problem is not really the tone of our voice.
I can try to speak louder.
Try to speak louder. In the meantime, I try to open this.
Okay, so I will try to go on. Is that better?
Yes.
With a louder voice. Okay, thank you. Sorry, I'm a little bit sick as well, so it will not come out very nicely, but I do my best. So together with the Victoria, we manage the interface of the thematic network space on the EU Health Policy platform. We do invite you, if you have not joined yet, to join to be able to consult the documents herein. And I will go directly to the issue we tackled today. Why did we choose to apply with this topic? Because the societal impact of pain, there are numbers which make us react. As you might know already, there are 740 million people in Europe, and we all experience pain at some point in our lives, but 20% of us do experience pain on a regular basis. So that's 1 out of 5. That makes the total to 150 million people experiencing pain on a regular basis. These numbers are making us worry and making us react. So therefore, our actions under the societal impact of pain platform. We are also concerned with the fact that the pain-related conditions affect the way we are working, and the costs related to work absence, being it permanent or temporary. You can see on the slide the numbers that are affect nowadays. What we have done so far within the Thematic Network project, as you may know, societal impact of pain was already present on the health policy platform with the SIP stakeholder group, which gathered stakeholder and endorsers of the SIP platform already. So we used the information we had and the contacts we had within this platform to start this project. And we have backed this up by a thorough research and documentation, and put up a first draft of the paper, which was then submitted to a working group formed by civil society groups, which were concerned with pain or which had pain as an object of their activity, and they have submitted some input which we have taken into account. We have gathered all the best practices and improved our draft paper with all this information. This brought us to a version of the draft which was discussed in the first webinar we had on the 25th of June. This webinar brought some new stakeholders. We had some pertinent observations and some good feedbacks that we have also integrated. And the last version of the paper was submitted to your attention, and hopefully you have been through the document by now. And that brings us today. In order to go further, I would like to let Victoria present the document more in detail, and we will start with the structure of the document, and we will detail. If you have any questions in the meantime, please do not hesitate. We do have a question and answer session at the end of the session, but if you have any question which is related to the content directly, please do not hesitate. Thank you.
Yeah. So thank you, Anka. I will try to speak as loudly as possible. I hope that you can hear me. In the previous webinar, we really focused on the structure of the paper and on all the policy initiatives that we gathered with relation to the societal impact of pain and the advocacy initiatives both of our community and our partners. The societal impact of pain can count on 300 endorsers, so we had really a lot of people to contact to understand what they were doing in this area, and actually the thematic network allowed us to expand further. So what I will do in this presentation, because we went through all of these and this recording is also available on the platform, I will rather focus more on briefly what are the gaps that we identified in the paper and the recommendation. So you see here the structure of our paper, and given how broad the topic is, we have focused really on 4 topics that we saw as paramount, not only just now, but throughout the years that we've been on this platform. And those are quality indicators related to pain, the employment of people living with chronic pain, further research into pain as a whole, and education of healthcare professional, patient, and the population as a whole on pain. So I will go now in each of these topics and the recommendation that stemmed through our research. The first topic is the one of indicators. What we mean by that is basically 2 things. On one hand, it's really not possible to do evidence-based policy without sound data, and those are something that lack when it comes to the societal impact of pain. And then there is also another, a further step there, which pain is such a big component we found in our advocacy and we restate in our paper, is such a big component of the experience with healthcare systems that it can also be a component of quality indicator for the healthcare system as a whole. So, and in that sense, as well as when it comes to gather data on the societal impact of pain, there are already tools at European level that can be leveraged. It's quite telling that the European health indicators include an indicator on musculoskeletal pain, but is under development because the data to fill that indicator are lacking. Clearly, there is a lot to do in terms of national agency and gathering stats, but also there are, as I said, opportunities at supranational level and at European level that can also be used. One of that is the partnership between Commission and OECD to produce the Health at a Glance reports, we believe. And because those reports, they provide a snapshot of the situation of healthcare systems and really the status of health in Europe. Pain has already been mentioned there, especially when it comes to the burden on employment, which we saw some pretty worrying data about before and more at length in our paper. But more can be expanded in considering pain as an indicator. Another opportunity there is a project on patient-reported outcome survey that the OECD is developing. And while looking at people with multimorbidity and several chronic conditions, pain is clearly a big dimension of such conditions. So other existing initiatives that we recommend to leverage are, for example, the 2006 Health Eurobarometer that was including, in fact, a question on musculoskeletal pain and there are a lot of data and surveys that also the civil society has done in the throughout the years. So there is a lot of expertise that should be leveraged and taken into consideration. But it would be timely to repeat this survey, we believe, given that after more than 10 years you can have a sound comparison of data. Another important opportunity is the WHO update of the international disease classification. So ICD-11, that is now is in fact the 11th update, is something that the WHO really used to create a common language to talk about the performance of healthcare systems and to really exchange data. It was a long process of updates, and now the WHO ICD-11 is available, has been released in June, and will be further discussed by the WHO Assembly next year. Clearly, again, there is a big part for member states to work on, because they have to, it's their role to implement the ICD-11, but there's also a component of the researchers, the healthcare professionals, the civil society in educating on the uptake of this new codification, which is very important for us because it includes, along with other pains, chronic pain as a separate entry. And this is new for us because we have been, our community have been pushed for chronic disease, chronic pain as a disease in its own right for several years. The second topic that we tackle in our paper is employment. And again, we have this very worrying data that we have shown before. And in a nutshell, chronic pain is the #1 reason for workplace absenteeism and disability in the EU. So that's clearly, this calls for overcoming a silos approach between health and employment policies. And so one can hope that the approach of health in all policy brings to such a synergy and not to a disappearing of the health component. What we can also refer back to our paper again of example of national initiatives where there is, for example, common budgeting between employment and health, and employment and pain policies. There is also better better results when it comes to return to employment of people living with chronic diseases. Again, there are initiatives that can be leveraged and can be taken inspiration from. One are the recommendation of the Pathways Project, which we're looking specifically at flexible and environment friendly to people with chronic diseases. And some interesting findings are that the current policies across Europe when it comes to chronic diseases are not really tailored to people with chronic diseases and their return to employment, but rather to people with disability in general, which is very important, but it doesn't tackle the specific needs of this population. And so more can be done to uptake the recommendation, and there are also follow-up projects like the CRODIS Plus one that is currently developing a toolkit for employers of people with chronic diseases. And in this realm, chronic pain is really important because the OSHA agency, the Agency for Health and Safety at Work in the EU, tells us that in fact the main cause of between the chronic diseases for unemployment is chronic low back pain, headache, so all these painful conditions and pain as such. Then the third area where we focused is the research one. So clearly this is quite timely because of the new European budget and the approval of Horizon Europe. But we also need to remember that a lot have been done before, and investment have already been put in place for the study of pain and the further research in the pain sphere, both through FP7 and Horizon 2020. However, there is really a lot that has to be done still to understand the molecular and cellular level of pain, so the real medical causes of pain, and even more the behavioral and socioeconomic impact. More has to be done to bring the patient into the design of research, which is something which is certainly lacking and can be also useful for the dissemination of research. In practical terms, this will be important for for the next policy agenda of the future years, and especially the next one. So clearly, we have been active as a community to bring our comment on the importance of including pain in both in the multi-annual financial framework. So we responded to the consultation at the beginning of the year, and we responded to consultation on mission-oriented research, proposing pain for mission-oriented research. In fact, it will be quite a bold and inspiring research to have a Europe as free as possible from pain, but also quite a concrete one, given all the impact that pain has on society. Of course, the work is not done with the Commission proposal and including pain as a heading, but it also has to be approved by the Parliament, and the Member States have to agree with the allocation of such resources. So we recommend, of course, that. And finally, also at systemic level, how to bring this research really to the healthcare systems. Well, that would be important to have center of excellence that focus on pain in Europe. There are already some examples, but really much more can be done to create a network. And we have the excellent example of the Center for Rare Diseases. Also, we have a basis of legislation in Europe for that. So this is something we wish to be further explored in the next year. And I go to my last topic. I know that we have been through a lot, and again, I want to reinforce that much more detail are in our paper, and we can go back to any detail that we want to go more further in the Q&A session. But I'd like to really finish with a topic which is really close to the heart of the European Pain Federation, given that we, as a non-profit organization, we work a lot for disseminating the education of pain for healthcare professionals, meaning doctors, but also allied healthcare professionals. That doesn't stop there. Of course, also the patient community and in general, the society needs to be educated on the fact that pain chronification brings a lot of danger and can have a huge impact on lives. At the present stage, pain medicine is not taught as a dedicated subject in most European academic systems. However, there are some best practice, and it would be important for the Commission to help us and help government coordinate the share of best practice. In that sense, the platform that DigiSant has already created for best practice sharing would be hopefully a big stepping stone for sharing such activities. And we also hope that our paper, given that it enumerates so many good practices, can be of help to this knowledge sharing. Finally, even if again education is the competence of member states, we have in the past 10 years that SIP has existed, we saw how important it was to have champions in, for example, in the European Parliament that help us foster awareness, because really this helps opening doors at national level, even if it doesn't have the immediate tangible result. And finally, the recommendation really cascades at member state level, because that's a national competence to promote wider access to pain education to healthcare professional and patient and the civil society, well, the society as a whole. This was more or less the paper, but we could not have done that without really seeing what was out there in terms of great activities, great best practice, and basically all the work that has been done. And here we have a snapshot that Anke can further elaborate on.
Really a snapshot, so does not include all the initiatives that we included in the paper, but the most representatives of them, and we have some other endorsers, and we do have hope this webinar would give us even more support. What do we do from now on? As I said, we do hope if other ideas are there to be put forward to us and to be able to include them in the final document. We will continue the campaign of sharing the information contained in the document, and inform our partners, our endorsers, how they can use this paper further on. For right after the webinar, we would like to leave the paper open to feedback for another 2 weeks, ideally, so that we can, by the 25th of October, when it's the date of the Societal Impact of Pain Steering Committee meeting, we can validate this paper, we can present this and discuss this with our leaders and see how we can further use and leverage it for to a final form. On the 12th of November, we have been announced that would be the final date when we will present the joint statement. And further on, of course, the paper is to be used by its endorsers, by the platform, and we will present it to as many events and possibilities that we can create ourselves as well. We will firstly, right after the presentation of the joint statement officially, we will participate to the 11th European Public Health Conference in Ljubljana on the 20th of October, and we do hope meeting there some new endorsers as well. We will continue then via our stakeholder group, of course, to use the paper, and we will communicate about our communication channels. The Societal Impact of Pain platform uses the website, a newsletter, and intensively social media to disseminate the information. And then we will, of course, as I said, continue to use the stakeholder group. I don't know if Gudula, you would like to say something more in detail about the communication? We have to give her yes. At this point?
No, I think it's not possible. Can you hear me?
Yes, we can hear you.
Yeah.
Ah, okay. So, sorry. Hello, here's Gudula Petersen from Grünenthal, and I really would like to thank all of you to join this webinar. So it seems that with our social media communication, we really reached a lot of people. And please register for the newsletter if not done so far. We will continue to communicate, especially also when the joint statement is prepared, so that we endorse for this paper. And we will have the final presentation of this document then in the meeting on the 11th of November in the European Commission. So before that, we will really communicate a lot to our endorsers and to our supporter of the Societal Impact of Pain platform.
Thank you, Gudula. Just a small correction, it's the 12th of November, so that we present the paper, so not to confuse our audience. I think we can, at this moment, give the microphone to you, dear participants. We have prepared a set of questions that we think are still to debate. In this, you may see them. I will not read them individually. We have just grouped them by chapter included in our paper. So please pick any, and we look forward to your input.
Or pick others.
Or bring your own, yes, of course.
Hello. Thank you very much. Thank you very much to Vittoria and Anka for the presentation of your paper. and also for preparing some pertinent questions. Um, just two reactions from my side. There are a few minor comments I have on this paper, which I will send to you in writing. A more general comment would be, this is a very comprehensive paper, and that makes it also very valuable. But that also comes with the caveat that it has already 25 pages. So you may wish to give some thought if there's merit in either providing a summary or some kind of accompanying infograph, like you had on your slides now, to those who just want to get an idea what it is about. And then once they have an idea, oh, this is about indicators, this is about education, I would like to get some more information, then they may resort to the comprehensive information you provide in your paper. So that may also attract more interested person. And so you cater also to those who are not wanting to dive completely into the topic. Then, yes, if I can just say two sentences also on the best practice portal, the DG Sunday best practice portal, which you mentioned, is of course there to help you, but the portal is only as good as you make it. So, you know, if you think we can help you with submitting with sharing best practices, we also need those who submit them in the first place. So, if you would like your stakeholders to submit practices to the portal, you know, there is also a call from our side to all of you that please submit practices to the portal, because we cannot know beyond our projects or other activities we fund what else is out there. So everybody is invited to send a practice or two to the portal for evaluation. So I would like to open the discussion now. As Blanca explained, you have a little hand sign next to your name. So if you would like to ask a question or to comment on the paper, please just raise your hand and we will give you the floor. If you don't have a microphone, just send an email or a chat. In the chat, send your question, and then we will read it out loud so that Victoria and Anka can reply to it.
So I've noticed already 3 questions.
I saw that Willem Scholten asked for the floor, so we will unmute you. You can go ahead. Hello, Willem. Willem Scholten. Willem, do you hear us? We gave you the floor.
I hear you, but it doesn't work from my side.
No, I heard you earlier.
Yeah, before we managed to hear you.
There seems to be a problem with Willem's microphone, so maybe you can fix this and we will take somebody else in the meanwhile.
Yeah.
We have Tadeusz who asked for the floor. Tadeusz, can you hear me? Tadeusz, can you hear us? We have another person who asked for the floor, who is Bart Molion. You can take the floor, Bart.
Can everybody hear me?
Yes.
Okay. Thank you very much, Anke and Victoria. My name is Bart Morlian. I'm the president of the European Pain Federation. I want to stress two of these questions, which are very relevant also for our federation of professionals to advance, because we really are in a process where we are extending our educational initiatives, and we focused mainly on healthcare professionals in the area of pain medicine. However, it's far more important to address also all allied healthcare professionals. So we're thinking into the direction of proficiency in pain, including also, and that's more relevant also on a European level, to include also the topic of pain in health behavior in the education of kids, starting primary and secondary school. So there are many initiatives, and there are some lighthouses out there in Europe where lifestyle and health education is part of educational programs in the general systems. And we want we're exploring together also working in that direction. So we're very keen to hear also the ideas of other participants on this. And then for pain research, of course, we're finishing. There is a good paper available, so it should be a very nice backbone to guide also the pain research strategies. Thank you.
So I see that maybe we can hear.
Victoria, would you like to give some feedback to Bart?
Yes, that's well. I think that it's really quite important, and in fact, we have tried to expand as much as possible in the paper, because that's actually the power of this initiative, the fact that we can enter in contact with other professionals beyond the one of our federation, which is of course a very diverse group. But even more, it's important not to reinvent the wheel, and for example, bring on board the other association that can do and can complement what we are proposing here, and can also endorse and support. We can endorse and support each other. So that's really the part that we do, and hopefully we describe it in a way which is concrete enough for moving policy action, because otherwise it stays on paper and it stays as the best practice of civil society. So we really do hope that what we are doing in several domains can help us move forward. That would be my comment.
May I just add one comment? Yes, Gula again. And unfortunately, Pete Moore is not able to attend today, but there's also very good educational programs available from patients. And we have really seen several very good practices. So this is also an important aspect where even patients sometimes educate healthcare professionals about their view on their disease.
Yes, yes.
Mm-hmm.
That's a very good point. That's also something we are looking more into with Pete. And if you look, actually, I suggest also to those who want to learn
Yes.
about this in the paper, in the joint statement, there is an overview, including the work on the pain toolkit, which is a self-management tool for patients and written by patients. So that's at least you know where to find it, because we have created a very comprehensive overview.
Thank you for this contribution. We have a message from Willem Scholten saying that his microphone should be working now. So Willem, if you hear me, please go ahead.
Yes.
Try again.
Can you hear me now?
Yes. Yes. It's a bit
Fortunately.
soft, but it's okay.
I'm sorry it was not working a moment ago. But I was kicked out of the webinar several times. I had to start up again. So when it's working now again, what I'm missing in the the presentation and what you say about the paper is a view on access to opioid analgesics. At the moment, that's really under threat, and I know it's national competence, not the competence of the Commission or the EU in any other way. But many national governments are at the moment placing barriers into the access to opioid analgesics because they fear for people dying from opioids. And actually, they look at the United States, and there's a lot to say about that because there already people are misled by the official information, I think. But so there it's not that serious regarding to opioid analgesics. It is serious, but don't misunderstand me. But it does not come from pain patients. And in Europe, there's evidence that it's not coming from pain patients. When we look to the reports of the EMCDDA, the European Monitoring Agency for Drugs and Drug Dependence, then we see it comes from illicit opioids, not from opioids prescribed to pain patients. But in Denmark, in Finland, they already took measures that make it much more difficult for pain patients to have access. And I fear that more countries are following. I know in the Netherlands there will be a meeting in the ministry. I don't know what side it's going, but the fact that they are organizing it is already a sign that they are considering measures. So maybe in one way or another, we can take, for instance, it's from the view that any policy measures at the national level should be based on science.
Of course.
And for instance, from the facts delivered by the EMCDDA. And I think it's also important that DG Santé works together with the people in, I think it's DG Justice, on drug policies, because they could easily put measures in place that interfere with your policies. Thank you.
Thank you, Willem. Victoria or Anka, would you like to react?
Yeah, so I think that the issue has to be taken into account through several perspectives. So for speaking for the European Pain Federation, we have our own position on the use of opioids, and that's something we do beyond this initiative. We do as medical federation. That clearly states our scientific approach. And on that point, I totally agree with Willem that any policy initiative should, in fact, based on science. And in that sense, it's also important to make a distinction between the prevalence and the incidence of this problem in the US and in Europe, which is something we are really working in right now. And but I think that also the question was not only direct to us. There were a lot of comments, if I understand correctly, about the need of further policy initiatives. And on that sense, I know that also the OECD is working on a project with the Health Ministry of Canada on in parallel with the Defense Authority and the Drug Control Authority. I can share the information I have on that as well, but it's more of a different initiative. And for when it comes for the perspective of the patients, I don't want to speak on behalf of anybody else.
Yes, we do have a statement regarding the use of opioids, and to resume, we do think that patients should have access to the treatment that they, with the help of the healthcare professionals, consider appropriate for them, and they should be free to choose and have this option to choose.
Thank you. Tadeusz has sent an email saying that, a chat here saying that it seems to be okay from his side, the microphone. Tadeusz, would you like to try again?
So here I'm trying. Can you hear anything?
Yes, we hear you.
Okay, excellent. So yeah, this is Tadeusz Hewlett speaking from European Federation of Neurological Associations, otherwise known as EFNA. We are closely involved in this initiative on the societal impact of pain, as we think it's very relevant to our areas of work. We represent patients with neurological diseases. And at this point, I think we feel particularly close to the topic of pain in employment that you included in the question slide. So I'd like to perhaps say a few words here. So starting with the best practices on flexible work environment, I think first I would like to say that there is evidence suggesting that flexible work arrangements themselves can actually have benefits in terms of preventing some of the chronic diseases such as pain, let alone mental health. But we touched more largely on the topic of the flexible work environment in EFNA's book of evidence. And so among many examples of good practices which could be applied EU-wide, perhaps I would mention here an example from Finland, where they offer all employees with long-term illnesses an opportunity to work part-time. So it means that apart from regular sickness allowance, it's also possible to apply for partial sickness allowance, that's how it's called, and it's meant to help continue to work or return, or even though to return to work even though you still continue with your illness. So that's one example of this flexible work environment. I think it's also important to mention that we need to have, it's important to have a supportive legislative frameworks in various countries, and I could mention here, for instance, Equality Act 2010 from UK, with a discrimination law which protects individuals from unfair treatment, and it promotes also a fair and more equal society. So employers have actually a legal duty to provide support for workers with chronic illnesses, and they are asked to make what is called reasonable adjustments in the workplace that would be supportive. In terms of the second subtopic, which is how can we best make sure that people with chronic pain are reintegrated into work, again, I think it's important to always remind ourselves the fact that the worklessness is associated with poorer physical and mental health and well-being, and to this end, work can be therapeutic and can reverse the adverse effects, health effects on unemployment. And that is true both for healthy people of working age and also for many disabled people. Now, this being said, EFNA and Pain Alliance Europe are leading the work of the European Parliament Interest Group on Brain, Mind and Pain, where, as you can hear, brain is a very important part of our work. And indeed, during various meetings that we've had, around 20 meetings so far in the last few years in the European Parliament, there were many compelling presentations speaking about vocational rehabilitation from experts in this field. And vocational rehabilitation is a multi-professional evidence-based approach that is supposed to optimize work participation, and it's clearly one effective way to get people with chronic pain back to work. And so it promotes a multi-sectoral approach, and it particularly bridges better health and employment, which often has a lot of gaps in between. And it also emphasizes biopsychosocial perspective in assessing and treating these conditions. So one of the things also that I wanted to mention in this context is a lot of misguiding public perception that in pain the pathology needs a rest to heal, but we know that very often it is being active and staying at work that actually can help and heal. And there are also some other good examples in other fields, such as cancer, in terms of returning people to work. So this can be also explored by our network as a template for the chronic pain community. And finally, an important part of supporting employment and economic productivity in this context is, of course, improving access, on one hand, to existing services and treatments, but also facilitating the development of innovative medicines to better manage these conditions, because if people are not well enough, then they cannot really benefit from any support that might be created or deployed. Thank you.
Thank you, Tadeusz.
Thank you very much, Tadeusz. It was very interesting, also examples you gave there. And if you're not in touch yet with the CRODIS Plus work package 8, which looks also at employment of persons with chronic diseases, Matilde Leonardi is the leader. I would suggest that you may want to get in touch with her to also see if your knowledge in this area could be made use of in CRODIS Plus. Victoria, would you like to react to Tadeusz?
No, that's correct. Many of the things that that Tadeusz touched upon are mentioned in our paper, and I think that ties perfectly with what we were saying before about sharing these very concrete examples of best practice, because when it's kind of clear that they work at national level and they have been implemented, it's much easier to share and replicate. So that's it's quite encouraging when you see something that can actually bring to a template, and that's also related to the examples in other communities. That's something we have to do much more, because there are great examples from other disease communities, and the cancer one is a very developed one that have done a lot of work that we can learn from. And yes, so it's I completely agree with this quite concrete approach.
Thank you, Victoria. We have one more person who is asking for the floor. That's Hiltrud. We will unmute you. Hiltrud, please go ahead.
Yes, thank you. I'm Hiltrud Liedgens, Market Access from Grünenthal. And I just wanted to comment that I'm really glad to hear that there is broad consensus in the auditorium today about the importance of patient involvement in decisions, but also in research. And this would be one area where I think even more focus of companies, European Commission, and also of expert groups to further involve patients also in research directly. And by this, in my opinion, it's a very good way to define core outcome sets together with patients to see what is important for them in pain research. We know already since long that this is not only a reduction of pain, but that treatment of pain goes far beyond that. And here we really need the voice of patients to tell us what is important. And that is, of course, different if patients suffer from osteoarthritis of the knee or if they have cancer pain or so. So it cannot be the same outcomes for each pain indication, and this needs to be carefully defined, I think, to help patients, but also to make research comparable in this phase. Thank you.
Thank you, Hiltrud.
Victoria, Anka, would you like to respond?
Yes. Well, just to add that...
Just speak up, please, Anka.
Yes. Sorry, the microphone is somewhere between us. Just to confirm that indeed Pain Alliance Europe, as a representative of chronic pain patients, have been lately more and more solicited to take part into research projects and to make heard the voice of the patient in defining work packages in these projects. We also participate more and more often lately to patient advisory boards, where patients can share their story and their experience with pain, which may increase the knowledge of the healthcare professionals and all pharma companies elaborating medicines on how the treatments are received and what can be done to improve them. Thank you.
Thank you very much, Anka. We do not have any other participant who's raising the hand for the moment.
I think Liz Lisa said she tries to raise hand but doesn't see the button. I've seen a message passing by. I don't know if you can unmute her just without her raising hand.
Who?
Lisa Util. There's a message in the chat, I guess.
I'm still not sure who that is. Maybe
Lisa.
send an email to or
we can
send us a
see her,
message to
but,
the host to Santé.
Wait. Okay.
We can see her, but does that change something?
No. Can we put?
She's number 11 on the participants.
I'm trying to see if I can. Present to everybody? What can I do? Everyone? No, I don't know. If I can't really forward you the message. Lisa, maybe if you write to TG Santé in the chat instead than to us, they will see you.
Hi, I unmuted a few people. In theory, she should be unmuted.
Lisa, you will
Since
try
I
to
couldn't.
Speak
Hello?
up. Okay, maybe she will follow up with us.
Is there any other comments in the meantime?
Yeah.
You can, of course, take it.
Well, we didn't get any other message, and we also don't see a person raising the hand. And I see that also the number of participants that had been up to 50 is now down to 30. So it seems that we have exhausted questions and also the interest. So this is why I would suggest to end this webinar at this point. If anybody wanted to ask a question and you didn't have time, I'm sure that Anka and also Vittoria are happy to take questions and suggestions in writing for their paper so that it can be finalized. And I guess you are also starting now the first endorsement phase. I think it would be good that you can show already the first list of endorsers at the meeting on the 12th. Here again, you have the contact for Anka and also for Vittoria. And then, as they said, also after the meeting of 12th of November, the paper still will be open for other endorsers who may wish to sign up to it afterwards. So thank you very much for everybody for participating, and have a nice rest of the day. Bye-bye.
Thank you.
Thank you.